Hey, I'm Matt Geiger. My goal is to give you the full story with all the information, not just the facts from the political right or left. In this video, I'm going to go through the talking points and evaluate the health insurance solutions that you hear from both sides of the political spectrum. So here's the list of common Democrat talking points around healthcare. The US pays the most of any major country for healthcare. Despite this, we still have lots of uninsured people. That leads to medical bills bankrupting people. And after all this, we still have worse health outcomes. And it's all primarily caused by greedy insurance companies' profits. So to fix that, most Democrats have proposed either Medicare for all or a public option allowing people to buy into Medicare. The Republican talking points more center around opposition to Obamacare and the Democrat expansion programs, but specifically they've proposed allowing patients to purchase health insurance across state lines, expanding the use of HSAs and HRAs, that's health savings accounts and health reimbursement accounts, and loosening or eliminating the Obamacare rules around insurers. So let's dive into the specifics on each of these, starting with the Democrats' cost argument. We unequivocally pay more than any other country per person on healthcare by any measure, but we need to really understand why that is to unpack the argument. This is called a waterfall chart. It shows you the reason for changes between two numbers. So here I'm showing roughly what's causing the difference between our healthcare costs versus what they spend in other developed countries. There are a few common explanations that are not supported by the research and therefore don't even show up here. Those are underinvestment in social programs, and over-reliance on specialists versus primary care doctors, and overutilization because of defensive medicine. The cost difference is primarily from higher prices, specifically higher prices for hospital services and diagnostic tests, as well as higher pharmaceutical drugs. The other large piece here is the higher admin costs. The second argument is that we have lots of uninsured people, and that's also true. 9% of Americans don't have health insurance at all. In most other developed countries, the government either automatically covers everybody or every person's required to get health insurance. So uninsured rates in other countries are basically close to zero. Supporters of an expanded role for Medicare talk about the number of people driven into bankruptcy by medical bills. They say 62% of bankruptcies are caused by medical bills. This claim was based on a since discredited study. Further studies have found that there's no difference between bankruptcy rates for the insured and uninsured, which indicates that medical bills aren't the primary driver of bankruptcy. A separate study came up with 4% of bankruptcies caused by medical bills, and that's most likely closer, but definitely too low based on the methodologies in that study. The reality is a lot of times somebody will have a medical catastrophe which will impact income, like a plumber breaks his leg, for instance, and then can't work. So you can't necessarily blame healthcare expenses or health insurance on that. The real percent of bankruptcies that are caused by healthcare bills is probably somewhere in the high single digits or low double digits. As far as outcomes go, politicians repeat the phrase that we have worse health outcomes than other major countries despite our healthcare spending. So let's get into what they mean by that. Typically, they're referring to two of the more commonly reported numbers: infant mortality, the number of children who die within the first year, and life expectancy, how many years somebody is actuarially expected to live. And if you just look at these two numbers, we are significantly behind the pack. But to look deeper, I've got more waterfall charts here for you. I compared the US specifically to the United Kingdom, but you get a similar overall story no matter which major country you used. On infant mortality, you can see the UK is at 3.8 deaths per thousand live births, and we're at 5.7. The biggest factor here is just reporting differences, which is good news for the US. We count births that other countries just don't. Unfortunately, that still leaves about 60% of the gap. Birth weight explains 0.4 of that remaining gap, meaning that we have a higher share of babies born either prematurely or to mothers who use tobacco, alcohol, or drugs. And the final major piece is sudden infant death syndrome, or SIDS, in babies older than 1 month old. It's really important to understand that almost the whole gap, except for reporting obviously, goes away if you were to control for socioeconomic differences. So it's mainly about how a mother treats her body while pregnant and how the baby's cared for. It's your call if you think that's a failing of our healthcare system or the Department of Health or local government or community or family structure or whatever, but that's the full story behind that number. Life expectancy is the other major health indicator politicians like to point to. The UK comes in at 81.2 and we come in at 78.9. The biggest differences are from obesity, drug use, motor vehicle deaths, and suicide. And I would call these more issues of prevention. Once an obese person is being treated or a drug user comes into the hospital, they aren't statistically statistically worse off for being in the US. Similar to infant mortality, it's your call on if you want to task these sorts of issues with the healthcare system or not, but it's not like our doctors are less competent or anything like that. In fact, when it comes to actual medical treatments, the US is one of, if not the best, and lots of cancer survival statistics and mortality rates out of heart attack and stroke. The final talking point, that may be the most common one, is the blame on corporate profits, mainly from insurance companies and drug companies. So insurance profits are baked into the admin piece on our cost waterfall, so you could see that is a driver, but not the obvious largest driver. Same with drug costs. But these bars aren't entirely just profits either. So what Democrats refer to is only a fraction of these drug and admin bars. The majority of the admin variance is the cost associated with hospital and physician billing related expenses, and drug costs are largely driven by PBMs, pharmacy benefit managers. Certainly profit is a piece of the puzzle, but the focus on drug and insurance profits is misplaced. So to solve these issues, Medicare for All is one solution that's proposed by a contingent of Democrats. This takes slightly different forms depending on the version that you're looking at, but I'm going to use Bernie Sanders' version in general. So what this does is it gets rid of private insurance and instead replaces it with Medicare coverage for everybody with no copays, deductibles, or out-of-pocket spending. This is what's known as a single payer system, meaning that instead of private health insurance companies, employers, and the government all paying health claims, you only have the government as the single insurer. This is considered the most progressive approach being proposed and would prohibit private insurance from covering any of the benefits that are already covered under Medicare. So would Medicare for All solve the Democrat critiques of the current system? On cost, it would cut out the problem that Democrats point out of insurer profits, but as we talked about, prices are the main factor in how much we pay. But progressives say Medicare for All has a solve for that too. With single payer, the government will be able to negotiate rates on everything with tons of negotiating power. In theory, Medicare will see that we're paying more for a certain procedure than European countries and just decide to pay less. And since they're the only game in town, all hospitals will need to fall in line. And that's likely to happen based on how it's played out in other countries and the fact that Medicare pays less than private insurance today, but you need to take into account the fact that lobbyists and special interests are likely to have a significant seat at the table, just as they're involved in setting Medicare reimbursement rates for physicians, in the same way that they successfully lobbied Congress to block automatic Medicare cuts every year under the sustainable growth rate until Congress repealed it entirely in 2015. Medicare for All's largest impact would be insuring 100% of people. By definition, that problem would get solved in its entirety. The peace of mind for uninsured people and simplification of the process is really what you're getting here. So that's an analysis of the Democrat claims and what my research turned up. How about what its detractors say? Republicans and even some Democrats have asked how this could be implemented and how we would pay for it. Republicans have brought up common issues in other countries with similar healthcare systems, especially wait times and procedure rationing. They'll also point to the issues with the Veterans Affairs hospitals to show how bad U.S. government-run healthcare could be. Starting with implementation, Elizabeth Warren has said the way she would implement Medicare for All would be to start by bringing down the cost of drugs and insurance costs through executive order, pass legislation in the short term that will allow anybody to opt into Medicare, and then pass Medicare for All as a long-term plan. Bernie Sanders has said he'd just go whole hog, passing mandatory Medicare for All in its entirety as soon as possible. The concern with this is you're eliminating the entire health insurance industry, so there's tons of overnight job loss there. That's a concern that hasn't been addressed yet, and it doesn't really sound realistic to me considering all the people you would end up hurting in the process. On costs, Sanders has put forward a few ideas for ways to pay for Medicare for All. The cost has been estimated to be $20.5 trillion over 10 years. The largest chunks under Sanders' plan are coming from taxing employers, a 4% income tax on most people, and eliminating the tax deduction for employer-paid premiums because those will go away altogether anyways. Warren's plan is to get the money with a larger tax on employers, essentially matching what employers pay today towards employee health insurance, and a 6% wealth tax on net worth over $1 billion. The truth is her math doesn't quite add up, and based on my math, I don't think you can get there without a tax on most Americans. That being said, I think the cost question gets too much attention just overall. Democrats are lying when they say they wouldn't raise taxes to pay for this, but Republicans are disingenuous to treat this as an added expense too. Today, health insurance is mainly paid for by employee and employer premiums. Most likely, employees and employers would end up paying through taxes instead. I do want to quickly typically talk about a wealth tax because it's gotten lots of attention as a silver bullet to help pay for Medicare for all instead of having to increase taxes. 20 years ago, 12 major countries had wealth taxes, of which 9 got rid of them as of today because they were tough to enforce. Rich people fled the country and they didn't bring in enough money to justify the headache. So for a country like the US with lots of rich people and a lack of political will to expand the IRS, I think it's clear a wealth tax is politically appealing, but totally unrealistic when you start thinking about the specifics of how it would work. Let's look at the validity of the argument that Medicare for all will lead to longer wait times and healthcare rationing. In general, what the numbers tell us is that the US is one of the best countries in terms of wait times, but not that much better than countries with universal health coverage and a mixed public-private system. Single-payer systems in general lag the mixed public-private systems in wait times, but again, the differences are relatively minor. There are definitely outliers in certain areas which both sides like to cherry pick to either make the US look awful or show how bad single-payer systems are, so you should be skeptical of specific country-to-country comparisons in general. On rationing, most countries do ration healthcare by putting off elective surgeries or limiting access to the newest drugs when older, cheaper drugs are available. Democrats argue the US healthcare system is self-rationing, though, in the sense that people skip or put off medical care because of cost. So to that point, we saw longer wait times in the US a few years ago as a result of passage of the Affordable Care Act and a better economy. Now let's talk about VA hospitals. To some extent, we're talking apples to oranges here. The government not only insures the veterans, but also runs the hospitals and employs the doctors, which is not what's been proposed in the US by Bernie Sanders or anybody else. That's more on par with the socialized healthcare systems that they have in the UK. That being said, many of the poor tools and tracking methods that led to fraudulent wait time reporting a few years ago are still being used, so it's tough to know for sure what overall wait times are, so maybe that says something in and of itself. VA hospital satisfaction rates are very high compared to the private system, and that's actually a trend you see across all major country healthcare systems except the US. So you can either chalk that up to the fact that they're better or the fact that it feels like you're getting something for free even though it's coming out of your tax dollars. The public option is considered the more moderate Democrat approach to healthcare. In general, what that means is that people could buy into Medicare to compete alongside private insurance. The idea being that Medicare could force down the cost of private insurance through competition. This differs from Medicare for all in a couple key ways. For starters, the implementation piece is a lot simpler. It integrates within the existing system with private insurance still in place. That means existing jobs in the insurance industry are protected, and the possibility for the free market to effectively allocate resources or innovate are left intact to some extent still. But that's a double-edged sword. That also means those admin costs are left intact too. And if a public option doesn't effectively change insurance company incentives the way that we'd hope, you have the same bad incentives running rampant. And that's on top of the risk that lobbies and special interests are able to raise Medicare reimbursement to private insurance levels instead of the opposite. That means it's even more important that the system is constructed thoughtfully. The Republican healthcare solution has been to repeal the Affordable Care Act. Their own replacement idea is to allow health insurance portability, provide funding for states to set up high-risk pools, expand HSAs or health savings accounts, and replace Medicaid with per capita state grants. As far as Obamacare goes, there are tons of claims made by Republicans. It didn't make healthcare more affordable, reduced quality of care, limits innovation, increased hospital market concentration, reduced jobs, longer wait times, worse health outcomes, and many, many more. So some of these are fact-based and some are not. So I'll tell you what we do know based on studies that have come out. Based on research, in the short term, the uninsured rate fell and socioeconomic disparities in health coverage fell. But on the downside, wait times increased, care did not improve, healthcare costs did not decrease, it just shifted expenses from out-of-pocket to increased premiums because of the new minimum coverage requirements. Overall, the big thing with Obamacare was that more people got insured, mostly through Medicaid expansion, and secondarily through subsidies to low-income people on the health exchanges. Through that prism, all these studies are completely logical and make perfect sense from a continuity standpoint. With more people insured, you've got more people requiring health care, so wait times and cost go up. Ultimately, this ended up being a trade-off between getting more people insured on one hand and cost and wait time increases on the other. It didn't live up to the lofty statements that Democrats made about it fixing our healthcare system, but at worst, it was a trade-off in which people who made under 400% of the poverty limit were helped in the form of subsidized insurance, and people who made over that were hurt in the form of higher premiums. To help people who would lose health coverage by an Obamacare repeal, specifically with pre-existing conditions, Republicans propose health insurance portability and funding to states to set up high-risk pools. Health insurance portability means that if somebody is insured, they must be allowed to switch plans if they want, regardless of any pre-existing conditions. A law like this already exists for employer health plans, so it does make sense for the individual market too. It would definitely help some people, but doesn't do anything for the large group of people who aren't insured to begin with, whether or not they can afford it. The other mechanism, funding for high-risk pools, is a solution to the death spiral, where sick people disproportionately buy health insurance, making it too expensive for healthy people who then don't buy the health insurance, making the problem even worse, and it just continues into a spiral. With high-risk pools, the federal government would give states money to insure people rejected by insurance companies because of pre-existing conditions. High-risk pools have been tried in a number of states, and the results are mixed and come down to adequate funding. People rejected by insurance companies are rejected for a reason. They're incredibly expensive to insure, and because of that, many states have underfunded high-risk pools, so you end up with a wait list or unaffordable plans. In the states with adequate funding, it did work really well though, of course at a very, very steep price. Health insurance portability and high-risk pools are legitimate tools to get people in individual markets insured, but keep in mind they don't directly offer any solution for people who are healthy but just poor. Republicans also want to expand HSAs or health savings accounts. These are tax-deductible investment accounts like a retirement account, but can only be used for healthcare expenses. HSAs are only allowed with insurance policies that have high deductibles, so the idea is that people will seek out lower prices or be more prudent in seeking medical care if they're spending their own money versus spending the insurance company's money. Specifically, Republicans want to allow HSAs to pay premiums, allow their use even without a high deductible health plan, and increase contribution limits to HSAs. Studies show a slightly lower discretionary spending on expenses like pharmaceuticals and doctor visits when it comes to HSAs, but not on higher dollar spending. No studies are able to say whether this is the result of self-selection or changing behaviors though. From a conceptual standpoint though, decoupling HSAs from high deductible health plans seems counterintuitive if you want people to bear the financial burden of their medical choices. The final Republican solution is replacing Medicaid with per capita grants. So instead of the federal government paying a percent of state Medicaid expenses, typically half, it just sends a set amount of money to each state to spend however the state thinks is best. The argument goes that you give states money and they can use that money to be more efficient and innovative than the federal government could be. Also, the federal government wouldn't be on the hook for ever increasing healthcare costs. Democrats say it's just an attempt to spend less and will only lead to less money for Medicaid programs overall. There's probably truth in both sides. States could come up with solutions that are tailored specifically to their state populations, but there's really no evidence that savings would come out of all of that. Medicaid expenses already make up a significant portion of state budgets, so it's already a huge area of concern and attention for state governments. That's it for the talking points and proposed solutions on both sides, but I do want to say that healthcare is extremely complicated, and because of that, there's so much room for innovative solutions. The problem is that we live in an age where it's about quick sound bites for politicians and the media, and because of that, I think our options for solving this are really disappointing. The Democrat solutions are based around the false idea that insurance profits are to blame for rising healthcare costs, and Republicans just oppose whatever the Democrats stand for on healthcare. Republicans created some token ideas because they took heat for having nothing, but their proposals are like changing a flat tire while your car's on fire. It'll take a bold, creative, intelligent leader to give us the solutions that we need on healthcare, and unfortunately, I'm not sure we have any of those among our politicians on either side. Thanks for watching. Hey, if you found this video interesting or useful, please give it a thumbs up, put a comment below, and subscribe to my channel to get any updates on new videos. If you didn't like it, you should probably go ahead and put a comment below too to let everybody know. Either way, thanks for watching.